Developing as an ACP is challenging. It is a lot of hard work. As well as undertaking master's level study, you have to develop the capabilities in your clinical setting and be able to put that academic knowledge into practice day to day with your patients. But it's hugely rewarding. There are so many opportunities and ways that you can then develop your career going forward.
The challenges of undertaking the Masters is that it's done alongside a full-time job, so it's very different to when I did my undergraduate studies, trying to get that balance between full-time work as well as the study that goes alongside it. Having that close patient contact was difficult to start off with because it wasn't something that I was used to doing, and it might have started off as something simple as recording a blood pressure, so the fact of having to manipulate a patient's arm and move it around or ask them to take off their jumper was something that I wasn't used to doing, and so it took a bit of time to get over my barriers really in kind of having that close patient contact.
I think first and foremost you need to love patient care. You need to really enjoy that one-to-one interaction with patients. You need to also be somebody who's comfortable with autonomous care, because not everybody is. You also need to have a degree of zest and oomph so that you're comfortable with leadership and with educational, because to me the leadership and the educational roles go hand in hand. And that takes a certain amount of courage. You have to be, I think, willing to speak out, because I think whether you're in a large team or a small team, if you can see that something needs improving or could be improved, then you need to have the courage and also the academic ability to back that up with the research and the study.
If you're thinking about it, I'd say speak to somebody who is an advanced clinical practitioner. Spend a day with them, see the work that they do, and you'll formulate your own thoughts around that, whether that's right for you. Speak to whoever's your lead for advanced clinical practice in your organisation, because they'll be able to be really honest with you about the challenge that is faced. It's not easy, it's not an easy pathway to follow. But for the right people, it's an amazing pathway to follow. I'd suggest anybody really supports practitioners who have that aspiration. That's the first thing, is getting your workforce to understand advanced clinical practice and what it really is. And also that you've got a role for them, because I've learned from colleagues that a lot of people go through the pathway, but they haven't got a role at the end of that. You need to be really clear about your strategic workforce plan and where they sit in your strategic planning.
With the future of the NHS and the way it's being shaped, I think we all need to be in a position where we need to embrace change and take up these new opportunities as they arise. So I think if you don't jump on board now, then you're going to miss that boat and miss out on the opportunity.